Welcome. Hello, MACC members. I'm Laurel Hansen, MACC's Program and Member Engagement Manager. Welcome to Ask MACC, the Workforce Edition, brought to you by the Metropolitan Alliance of Connected Communities and our Human Resources team. We know our network is faced with ongoing and incredible challenges when it comes to workforce. It's how we provide valuable services to the community. Our workforce challenges can create difficult hurdles for our organizations to operate sustainably. There can be complex and seemingly insurmountable barriers, but luckily we have an incredible HR expertise at MACC. And as a part of our network, you have access to that HR expertise through our convenings and working with so many of you in the MACC network. During this brief conversation today, I'm joined by Quinn Daley. Quinn is the HR operations specialist at MACC, and he brings his expertise to MACC and our members to provide all of this HR guidance that they need to be successful. Thanks, Quinn, for joining me today. Nice to see you.
Nice to see you too.
Yeah, well, I'm excited to talk to you. And during this chat today, we are going to talk a little bit about the trends and benefits and really how organizations are engaging employees in benefits design. So this is going to be an interesting topic to jump into.
Definitely.
Appreciate your being here, and I'm glad I'm talking to the person that knows the most about this topic at MACC. So thanks for being here. So been thinking a little bit about this lately and you know, this unique point in time that we're in right now. And if indeed we're coming out of the pandemic and entering what's starting to feel like this post-pandemic phase, then we're really in a changing environment that's impacting all aspects of the workforce. And through all of these conversations that we've been having and recording, we've been touching on a lot of these topics. And it certainly includes how we manage and offer benefits to our nonprofit workforces. So I've got a few questions to jump into today with you. Based on that introduction, have you seen what you would call any sort of post-pandemic impacts on how organizations are considering benefits?
Yeah, I think a couple things come to mind when you ask that. So number one, and I think the elephant in the room for a lot of folks is how it relates to recruiting and retention, I think. Number one, I think organizations in general are starting to place more of a focus on their total compensation packages. And I know when I say compensation, what usually, folks end up jumping to in their heads is just straight to dollars and cents. What's the hourly rate you're offering? What's the salary you're offering folks? But now I think there's more of a focus also on what your benefits package is offering folks. How easy are you making their lives outside of work and at work? So those can be things like, maybe bolstering up your medical insurance package. That can be formulating new types of leave you might want to offer to help folks face challenges in their own environments too. And that's a really, really big one. And I think that's just a shift in perspective that we're seeing. Beyond that, I think as well, something to think about here too is, just how much the workforce is evolving and how the workforce is showing up to work and how they can be helped with benefits. For example, as we're shifting towards remote work, it's kind of opening up possibilities for folks to hire folks maybe that are out of the region, that are out of the state. What types of benefit packages, can we offer for folks, maybe who are out of state? Do our benefits extend that far, for example? And then the last thing I think I want to bring up here is just, I think it's also moving the marker a bit on what's considered a benefit now that especially that workforce is evolving. Because with remote work itself, you could ask the question of, is that itself a benefit? Allowing folks to show up from their homes and clock in using their laptops. And as well, organizations too are considering supplies and equipment they're offering to folks in their homes to be benefits too. I'm seeing phone and internet reimbursements going out too. It's really, the pandemic has really changed a lot in the benefits world, and especially what our perspective on what benefits are and how important they are, and just in strategy for retaining and recruiting employees.
It really is a different environment and not just the status quo. And I would imagine it's really changed how what the requirements are for you doing this work and what the new territories that you have to explore. So given that, let's talk a little bit more about the trends in benefits. the workforce is changing, the workplace is changing. Does that mean how you as an HR professional approach benefits is changing?
It's a good question. I think as a whole, we're always adapting in the benefits world. And I think that's just because the landscape has always been moving rapidly. I think just lately it's been moving a lot faster, and with a new workforce coming in and, I know myself, I'm young and I'm a part of kind of the new workforce coming in. I think there's personally a bit more focus on how far, what benefits you offer can go and what they can be applied for. And as a personal observation, I'd say I think there's seeming to be more of a shift with employers to playing more of a paternal role when it comes to offering benefits, because I think employees want to work places that make their lives and not necessarily just their work lives, but their lives easier outside of work.
Wow.
I'm seeing folks ask questions like, how far do I have to go to see a doctor on my health plan? It's not necessarily going to affect folks at work, right? But, if they've got to take after work and take 45 minutes to get to their doctor, that's reflective of your benefits plan and what you're offering. And makes a direct impact on their life outside of work. And as well, if folks are having issues at home, maybe, what options, are employers offering to allow them to maybe take time away and deal with those matters and really improve their work-life balance. It's a lot of things coming up right now.
Yeah. I like how you mentioned that benefits more than ever are a part of the value proposition for an employer to be like an employer of choice and how it can make you competitive. Yeah, we are seeing that benefits are an important part of that employer's value proposition. How do you think employees weigh benefits as a part of that total compensation? Does it impact the ability to recruit and retain a team? Like, what are you seeing in your field?
Yeah, I'm seeing it become more popular for sure. I think in the past year, more folks coming on board to an organization before they even get an offer are reaching out to me asking for benefits information than I've ever seen before. I think folks are taking much greater of a look at it. And I think, with that in mind, not necessarily all employees are going to do that though. And I think generally what I notice still is there's a lot of employees out there that, we still want to make sure understand, the benefits and how they work, because if they don't, I think what ends up happening, at least in regards to this conversation I think a lot of folks kind of default to placing a heavy focus on their salary or just their hourly rate in general. Because here's an example I can think of off of the top of my head. If I'm an employee coming into a job and I don't have a lot of benefits knowledge, or I'm not quite sure how the benefits package works, there could be one employer offering me, let's say $16 an hour, but they have really great health insurance. They subsidize it super well. It's very affordable. I can go anywhere to see a doctor, for example. But that rate is $16 an hour. But let's say, employer B out there is going to offer me $19.50 an hour, but the health insurance is poor. I'm not going to be able to do as much. It's going to cost me more a month. I think the numbers that are still jumping out to folks are those hourly rates. And, I want to make sure that we're still facilitating good conversation about those benefits and how employees can learn. So I would say in general, I'm seeing a lot of progress in that regard, but I don't think the work's quite done yet. I think we still need to really encourage folks to take a look at the benefits package and what our organizations are offering. And because I think it does, affect their overall well-being once they start work, and that really affects your ability to retain them.
Yeah, very, very much so. I think it puts the pressure, at least, or maybe it's better said, the opportunity on the employer to be really good at communicating and reflecting those benefits and that full package, and how critical that is above and beyond the wage. Because, like you said, if you only lead with the wage, you're going to miss out on some good candidates who may choose you if your benefits package is more robust. So being that we're, in a new era, a new workforce, a new type of workplace, the voice of the employee is more important than ever. And I'm just really curious about how you're engaging employees in the actual design of benefits, and how are we listening and learning, how does that affect an organization's culture? I'll stop there, and I probably have some follow-up questions.
Yeah, no problem. So I think it's really important to engage employees in that design, because if employees don't know how their benefits work, it's just so much harder for them to leverage them to their advantage and to create a better work-life balance for themselves. And that's whether we're talking about insurance, the types of leave available to them, or any other benefits in general. And, just regarding culture, I think as we all know, employees talk and benefits related matters, I think, are more common in conversation around the workplace than, we like to think, because I think, for example, someone might be talking, during a coffee break about maybe a surgery they had and all the costs related to it. Or someone might be talking about having a baby, which is really great news. But, what if they're talking about feeling like they had to rush back to work, for example? Because good or bad, I think these conversations will ultimately reflect how folks think their organization is helping them provide for themselves and their families. If good, your organization can get some great buzz going and begin, building a really solid reputation. And if bad, it might point towards some areas you can improve upon.
Yeah. What is the best approach for an organization that maybe they haven't engaged employees in benefits design, but they want to start and they want to get that input from employees so they really understand what matters to them? I mean, it's listening, but like how do you do that?
You bet. I think the number one thing is just making sure someone's available and knowledgeable on the benefits your organization's offering for folks to talk to begin with. If they don't know where to go, I don't think those conversations can start. And beyond that, I think it's also important to be kind of casual when you're talking about it. It's important material, but I think most people dread benefits discussions and dread engaging in it because I think those conversations can personally just be so dry and technical. I think when we apply, real life experience when we're explaining, benefits design and just strategies in general, and just to what we're talking about, it makes what you say relatable. It makes it more engaging. It makes folks want to tune in a little bit more because then they can pick out an experience in their life they can relate to and apply that knowledge you're sharing with them.
Yeah, well, I can certainly appreciate that, and at MACC, and it's great to have your expertise there. And also, yes, we want you to take care of the complex technical part, and so we can just be on the human side of really trying to understand how our needs can be met as employees of the organization. So, I'm curious: are you seeing anything new or different on the horizon in the world of benefits? And I mean specifically for nonprofit human service organizations, if possible.
Yeah. So I think on the horizon right now, I think we're still seeing a lot of the same that we've seen in the past, right? I think as far as I would say your health insurance plan, for example, that's kind of the meat and potatoes of your benefits package. I think, what I've seen over the past couple of years is rates continue to go up, but I think that provides us, or especially human service organizations, some opportunity to collaborate on changes that can be made and to really, leverage our power as a network there. Because I think there are conversations that can be had about what supplemental benefits can be offered in addition to, our health plans, for example, or, maybe one organization is offering, forms of paid leave. Another organization isn't. It's really worked for them well. And, maybe they can suggest that out to another organization. And then, one last thing too, I think, at least just on the horizon, what I've seen is there's a lot of opportunity here, for folks to really collaborate together, especially human service organizations, and share ideas about what's worked and what hasn't and what we want to do down into the future. Number one, something I'm seeing is I think there's a lot of conversation regarding supplemental benefits folks can offer in addition to their health plans. Health plans are very expensive generally for organizations to offer. To upgrade those can be even more expensive. So, for example, I've seen, organizations within our network pick up things like telehealth, like Nice Healthcare is becoming more popular across our network. It's essentially a free primary care clinic that can offer you free prescriptions, office visits, and telehealth in general. And that's a really, really great way to upgrade your health plan while keeping the cost increase as marginal as possible. That's one thing I've seen on the horizon. I've also seen.
And we've heard great things about that plan.
Yeah, it's really wonderful. The testimony we've heard from folks here at MACC and across, the members we have that have it is really, really positive because especially, for folks on like high deductible health plans, for example, it's a really, really great way for them to not have to, for example, put off an office visit because they don't want to pay full
Yeah.
costs. They can just go in and make sure that their issues are taken care of, for example.
Let me ask you a side question on that. Does MACC contract with NICE, or how does that relationship work?
You bet. The way that relationship works is we just sign a year contract with them for our employees to be covered. As far as the network goes, members can pick it up as they wish to. It's designed to supplement an existing health plan, but it's just on a year-to-year basis.
Yeah, and then the employee pays a monthly fee to use it, but then they get all these, complimentary benefits from it. So
Exactly.
Thanks for sharing a little bit more about that. And anything else that you see as a new trend or something on the horizon? Anything else you want to share?
Yeah, you bet. So, the last thing I think I'll share here is just the Minnesota Council of Nonprofits, within the past couple of years has opened up an association health plan that a lot of nonprofits are jumping onto. And it's really a product of, a lot of organizations wanting to work together to try to control costs in what way they can. And a lot of human service organizations within the state kind of fall into the small group pool, which is considered to be organizations with 50 eligible employees or less. And that kind of opens you up to paying rates that all other organizations would pay. It's not necessarily based upon your claims history nor your experience with the plan in general. Specifically your own history, but it's based upon, what small groups are doing as a whole. So, with the association health plan, it's a way for nonprofits to get together to join the same pool and to help control costs in that manner. And it's a really cool way to get around those large and small group requirements that health insurance carriers have.
Sounds like a great opportunity. And I'm sure if people want to learn more about any of those opportunities, they can reach out to you and to MACC and learn more. And thank you for sharing those. I just have one last question while we still have a few minutes together. I always like to hear examples, and I always like to hear about what other MACC members are doing. And I know you work with a lot of MACC member organizations. Without it, don't feel like you have to name specific names of organizations, but I'm just curious, are there any examples of members you've worked with or that you've heard about who really are making changes to their benefits, and specifically, trying to address some of the workforce challenges that we've talked about? Are they making benefits changing? And are you seeing any impact in terms of their workforce challenges that their benefits adjustments or assessments are making? Any examples you can share with us?
You bet. So I think the one that comes to mind right now is actually we had an a member recently who actually made health insurance and vision and dental all free for all of their employees, which was a huge development. And it's great that they had the funding to make that possible. But they really, really wanted to take a strategy there to make the benefits as affordable as possible for folks, just to make sure that they can enjoy their lives and feel like they're taken care of as an employee at that organization. And generally the impact, it was such a well-received decision at the time. We saw enrollment numbers jump up right then. More folks were getting enrolled on the plan. I'm, hearing less and less from folks at that organization as well. Not necessarily that is a bad thing, but I think, it's indicative that things also are working pretty well for them too. I've heard really good feedback when I have heard back from them, but there's not quite as many, frustrations or problems arising there either, because, the cost to be covered just isn't an issue for them anymore.
Yeah. And what a value proposition statement for that organization to be an employer of choice. And it's got to be making a retention impact. Like people would think twice about jumping into another sort of opportunity at another organization that maybe wouldn't offer that full coverage like that. So that's pretty amazing. And I know that's a unique opportunity that not every organization can do, but it goes a long way to show what the impact benefits can make on workforce challenges.
Absolutely.
Yeah. We've shared a lot of great information today. I appreciate your taking the time to to chat. That is all the time that we have now for this discussion. It's been really interesting. Again, appreciate your time, Quinn. And want to encourage our members to visit the MACC website and the Ask MACC page of additional resources, because you'll see this interview and also a variety of other information and links to helpful content, including more in this series of recorded HR interviews. So MACC members, keep in touch. We're here to support you and our network of MACC members. Thanks. Have a great day and be well. Goodbye.